Welcome to today's program and thank you for joining us. I am Madhuri Jha, Program Coordinator, sitting in today for C. Virginia Fields, former Manhattan Borough President and currently the President and CEO of the National Black Leadership Commission on AIDS. The mission of the National Black Leadership Commission on AIDS is to educate, mobilize, and empower Black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. On today's program, we will discuss transgender health and the transgender experience from two first-hand perspectives. Here to discuss this topic is our guest, founder and executive director, Kiara St. James of the New York Transgender Advocacy Group, and she is joined by Crystal LaBeija of the House of LaBeija. Kiara has been an organizer for some 20 years. She has founded New York Transgender Advocacy Group in addition to being an advocate for several legislative actions around transgender health issues across the globe. We're excited to have her here today with us. Crystal is a member of the House of LaBeija. In addition to being an advocate in the community for HIV awareness and trans issues and people of color, she has an organization with her husband that she would like to speak to us about today. So today we're just going to have a general discussion. I'm very excited to have you both here with us. Perhaps you can begin by telling us about the New York Transgender Advocacy Group and the work you all do.
Right. Well, thank you, Madhuri. Yeah, so New York Transgender Advocacy Group is a group that got started a little more than 6 months ago. And what we came together because we saw there was a need. And that need was to make sure that movements are led that are for the trans community, are led by the trans community, and we want to be able to make sure that our community's voices are being heard at the table when it comes to implementing policies, because too often what happens is we are thought of, but we're only thought of as far as like high-risk population, but no one really thinks about all the other issues that we need to have addressed as well. So we came together to basically address the importance of helping to impact policies. So we currently, well not currently, but during the legislation period, we go up to Albany where we meet with legislators. And we also we also have a linkage throughout New York State, as well as other parts of the nation to talk about how we can better impact our community for the better.
Excellent. And it's my understanding that you have a role in NITAG as well, doing youth development work?
Yes, for youth and young adults mostly. Right now we're trying to bring awareness to the ending epidemic blueprint. Actually, I think I met a few of the coworkers here while sitting on the panel that MAC AIDS Fund ran.
And for our viewers, the blueprint that she's referencing is the governor's plan to end the epidemic by 2020, and that is to drastically reduce new infections from 3,000 to 750.
Exactly. So through the Youth and Young Adults Media Program, we're hoping that it will create a platform and give us control over our own narrative. A lot of times we see a lot of people of trans experience being either, I would say, exposed or observed from the outside for their peculiar ways of living or unusual ways of living their lives. But for us, we want to also show them the other normalcies that we go through, and that we're just a regular. That we're normal people just like everyone else. So.
Excellent. So I want to ensure that our viewers are using this show as an opportunity to gain awareness and education, but also become sensitive to the trans experience and know the appropriate way to talk about it as it relates to non-judgmental terminology and inclusive language. So can you both please share with us the importance of meanings of such terms? I'm hearing you say trans experience, gender preference I know is one, cisgender, and then you're a member of the House community, so maybe you can share with us what some of those mean.
Yes. So we've all heard, there's an old nursery rhyme, sticks and stones may break my bones, but words will never hurt me. Well, we know that to not be true. Yeah. We know that words carry meaning and have impact, and it stays with you long after those words have been thrown at you. So as a child, if you heard words that were broke you down and made you feel less than, even well into adulthood, we know those words impact you. And so what we as in the trans community have been doing is controlling our narrative and taking back our narrative and letting folks know this is how you shall identify us, this is how you shall call us, and this is a way of us like really controlling our narrative and making sure like terms like biological, which have been used much too often, which is very problematic, and it's a way of letting folks understand, listen, there's certain ways that you need to approach us and to respect us. And first and foremost, it's about understanding and respecting how people self-identify. So you have terms like cisgender. And cisgender is a Latin prefix, and it means the same side. So to simplify cisgender, it just means anyone who is not trans or of trans experience is cisgender.
Got it.
And so those words came into being so that we could minimize the impact of using more hurtful and problematic terminology.
Such as like real girl, she's a real girl versus what's the alternative of that? You know, so it's like, it kind of puts you in an awkward position. And so, I mean, there's a term that's overused in the ballroom scene. Actually, there's a category dedicated to them. And I love my sisters, but at the same sense, when we get to the point outside of the ballroom, associating us as femme queens and only femme queens instead of women, it's starting to rub us the wrong direction.
Okay.
So now you have a lot of people of transitional experience being a little upset about that. And so we're trying to change that, or at least be more sensitive. We know within that environment, it may be okay, but you know, in other places, like we would like them to kind of do away with that. So a lot of times you see people use female figure categories.
Got it.
So it can be more inclusive. And because actually 2 years ago at the Latex Ball, I think 2013, there was an altercation. Someone who was post-operative wanted to walk women's performance versus femme queen performance. And they were saying, even within the community, they were saying that no, she can't walk that because she's not a real girl. And so there was a big a big uproar for that. So I think my chosen term would be woman of transitional experience.
Okay.
And what you see a lot of times is even within the ballroom community, for too long, what has happened is folks feel like they have a right to say who is and who isn't. And these are primarily gay men of African ancestry who dictate who is real and who isn't, you know, who is feminine, who isn't. So therefore, someone like me who's not surgically enhanced facially or anything, I would have a harder time walking a ballroom because I don't live up to their standards. Also, because my voice is deeper, it would be problematic. Like, oh, your voice is too deep, so therefore, you know. And so, what we want to do as a community is tell folks we have a right to self-identify. The trans community is the only community that everyone feels like they have a right to have a say-so in who we are and in our authenticity. And so that's something that we're definitely changing, you know, day by day. You know, we're a community that is no longer marginalized, but we're a community that's emerging. And because we're emerging, we are going to be demanding a lot more, you know. And so that's one reason why.
So if I'm hearing you, then it's really to just ask you how you identify.
Exactly.
And allow you to identify
Exactly,
yourself.
because the word transgender is an umbrella term. And so when media uses it, they're okay with showing a drag queen within that, someone who's gender queer under that umbrella, someone who is of transitional experience, but there also are people who like to live within normalcy and only associate themselves as a regular woman, and they would never even let you know about their transitional portion of their life because they know the stigma that comes attached with it. So therefore, when people know, that's the reason why when people say just because you're transgender, it's really used loosely, but no one knows that the word transgender doesn't mean just women of transitional experience.
Right.
So as media are showing these different transgender, they may use it properly by definition stance, but because of the ignorance of the modern society, because they're not exposed to this lifestyle or to these terms usually, they now look at every woman of transitional experience as if they're just a drag queen or a gender queer or someone who's gender nonconforming. But we all fall under different sectors of that umbrella.
And we all identify differently.
Exactly.
Not everybody likes the term trans. So not everybody in the trans community identify as being trans, simply because trans is more, a lot of folks feel like trans is more like a medical definition, and it was a term that came about like around 1990, 91, and it was a way to gather data and information about our community. So there are a lot of folks who you may identify them as being trans, but they don't identify themselves as being trans.
Exactly.
So it's important to understand, and as you said earlier, you know, ask us. You know, if you ask me how I self-identify, I have no problem, you know, letting you know how I self-identify, as opposed to someone assuming that they can just say, oh, because you're trans. Because some folks in our community just find it offensive to say they're trans. You know, so.
So you mentioned that it's a term that came out of the medical world, and we mentioned the AIDS blueprint that we have that's been put forth by Governor Cuomo. So we've addressed on this show that transgender women of color especially, but transgender women and men are a priority group for being at risk for HIV infection, so we should devote our energies to trying to prevent that. So I want to speak about that a little bit. You know, in your own experience, what are the issues facing the community of trans experience, and why is it a priority group perhaps to the governor, and what might make someone be at risk for HIV or hepatitis or any infectious disease?
Well, for me per se, personally, I know that those who have, some of my sisters and also me at one point in my life, due to lack of opportunity through the employment field, survival sex would be the form of, you know, stabilizing myself within society. And for some people, it catapults you as well. Hence the reason why, you know, all money isn't good money, but honestly, when you have someone who had to be on their own from 16 and never had a sense of ownership of their own things, and someone, the whole world telling you that you weren't gonna make it, putting yourself in a place to where you can have more than enough. You can be in big cities nationwide, and you can have all these monies and treats and gifts. That's a hard life to take away from, but also you forget and numb yourself with drugs sometimes. Sometimes you party a lot. Sometimes you have late nights with friends because you're single and you're here and there all the time. So, I mean, that increases your risks, but then at the same sense, what else do you do? You know what I mean? Like, without legislation, we've been trying to pass gender for a long time.
Yes,
We've
past
mentioned
14 years.
Can you explain to our viewers what gender is?
Yeah, sure. So gender came about because around 2002, there was a bill called SONDA, which is an acronym for Sexual Orientation Non-Discrimination Act. It was a bill that was supposed to be inclusive of all New Yorkers of LGBTQA, you know, spectrum. Around 2002, what the gay and lesbian community decided was that it was more important for them to get ahead. So in order for them to get ahead, they threw the transgender community under the bus.
Right.
So that same year, we came, Charles King, who's actually one of the CEOs of Housing Works, among some other folks, came up with the acronym GENDER, stands for Gender Expression Non-Discrimination Act. So for the past 14 years, we have been going up to Albany, speaking with legislators about the importance of passing gender for New York State, and understanding that, like, when you talk about why trans folks, especially trans women of color, are high risk, you also have to talk about root causes. And root causes are, you know, one reason why you have trans women of color who are more likely, 1 out of 2 black trans women is HIV positive. 1 out of 3 Latina trans women is HIV positive. It comes out of root causes, and the fact that folks are not addressing the fact that there's job discrimination, there's housing discrimination, as well as educational opportunities are often denied to the transgender community. So when you talk about health disparities, it's important to understand, like, Jobs are part of health disparities. Housing is part of health disparities.
Exactly.
So you can't talk about, oh, we want to focus on the trans community without focusing on creating jobs and other opportunities for us to have the resources that we need to become viable. We're already viable. We just need to make sure that we have the proper resources to where it's not so much underground economy that makes us viable, but it's other avenues as well.
I know that at the National Black Leadership Commission on AIDS, we are an organization that prioritizes working in Black communities to fight health disparities. But we are also prioritizing working with groups like NITAG because we see that there's a link between what you're describing, right? So you have an experience as a woman, but you have an experience as a trans woman, and then you have an experience as a trans woman of color.
Right.
There are a lot of things that become complicated there.
Yes.
Right.
So maybe you can speak to what that kind of partnership with an organization like ours, or you mentioned Housing Works as well, what that can do as a positive pathway to reduce health disparities or to reduce the risk of HIV infection in the community of trans experience.
Yes.
I think usually because it's almost like a new road traveled right now. Honestly, previously, the T was for two-spirited individuals. Like we said, it was an adopted term later down the line. So that the LGBT alphabet never really made a safe haven for people of color who are trans identified. So therefore, we had to be self-reliant for so long that having these groups and having these regaining their trust is the hard thing, and not seeing our sisters working with those organizations. I know the phone has been going crazy, but that's because my sisters call me 24/7 because they don't trust agencies anymore, because we've been a web for so long within each other. You know, so I think when we get out of just having one of our sisters on board or having one out of 40 different staff members trying to lead a support group and only call people to the medical office, but actually do outreaches and do events geared around them and for them with interests that's of theirs, then it will kind of lower the connotation of just thinking that you only want us there for, because a lot of them are, some are negative still too, but at the same sense, they'll still be at risk if they can't come to these, take the stigma away from what was already built from these organizations, you know, because of the long history.
And it's also important to understand, like the question you asked, you know, the reason why it's important for organizations such as Mblaca and Housing Works to collaborate with the trans community is because it shows investment. It shows that these organizations recognize the viability of our community, and that's the first step in getting folks to come to the table when when they start to realize that, hey, wait a minute, people are respecting us. People want to work with us. And also, you know, it helps to open other doors, because within the trans community, we often say this a lot. You know, I often say this a lot in my group, NITAG. We speak to intersectionality, and the fact of the matter is, being a person of trans experience is one of my many experiences I have. My first experience is a human experience, and that's what connects us, and that's what should connect us to everyone on this earth and in this city and in this state. Our experience first and foremost is a human experience. So therefore, one thing that we want to do as we work with other organizations is to normalize and to create those relationships where it's not like, oh, we need a trans person to go speak on this issue, because there's many issues we can speak upon. We don't have to just speak upon the trans experience, but we first have to get folks to recognize our humanity, and that's the first step in helping to eradicate this violence that is directed at our community. Currently, as it stands within the United States, 20 Black trans women of color have been murdered. You know, so that speaks to health disparities. That violence is real. So when you talk about health disparity, that's another thing that's there. And so that's one reason why we have to work together, because we're stronger with our allies than we are just being separate.
And one was my gay daughter in that toll this past year. So,
Sorry to hear that.
oh, it's okay. But at the same sense, it's like sometimes I look at the recent notoriety that the trans community has been receiving through public media. And a lot of times people ask us, how do we think that it has helped? Well, it showed that there's a need for a population that has been ignored for a long time and has been discarded to the underground. But at the same sense, it still isn't erasing the stigma through, of the people in our community. You know what I mean? Within the Black community, because through past cultures, through the biblical terms, because a lot of these, even though they may not all be churchgoers, that was a big core within the household. So a lot of these kids that do get kicked out are from a Bible Belt or a Bible thumping household. And so even the ones who are killing these women are people who feel like they're justified because we are out of God's will or His way of
Because they believe that.
Exactly.
They believe that,
So
right.
even though they may not be churchgoers, they still have these, you know.
We had on a previous show some youth who identified as being part of the LGBT community, and they spoke about their experience being in an affirming church and being youth of color and what that meant for them. I think it would be helpful for us to hear how, and one thing that they, might I add, is that they said mental health was kind of an overarching issue that a lot of at-risk youth in general have to confront in addition to all of these health disparities you're speaking of.
Right.
So can you speak to this specifically as it relates to transgender youth? How does the transgender experience fit into the broader context of LGBT youth and the issues they might be facing when it comes to sexual health and healthcare?
Yeah. So, the trans experience is it's different from individual to individual. So I, as a woman of trans experience, I can't speak on behalf of like my sister Crystal, because her experience is going to be different than mine. But what I will say is the commonality that we have is wanting to be respected and wanting to be acknowledged as folks who are not freaks, not folks who are just tolerated, but as a community of viable individuals who are coming together and trying to make the best of what we've been giving. Currently in the United States, there's only 16 states that has gender protection, and because of that, I'm going to have these conversations ongoing because of the fact that there is limited legal representation or protections for the trans community. It makes it much harder. We're fortunate because we live in New York City, to where we have a little bit more liberties and freedoms. But I also understand that there's trans folks throughout the United States who don't have the same freedoms that we do here. And so what I would say is that it's important for youth, especially if they're located within the 5 boroughs, to get connected and to get involved in making policies that are going to impact their lives for the better.
Actually, this question was kind of a challenge for one of the balls that I did in Western New York. And one of the analogies I said was HIV and AIDS is almost like a backstabber. And so I just encourage people to know the enemy, because if you don't know the enemy, you can't know how to fight it. And so therefore, a lot of times it's just telling people that although it may be a scary thing, it's a real thing and it's relevant within our community and our lives, because we have to deal with so many people and we have to deal with so many situations that we weren't technically ready for. Like a child who barely graduated or didn't get to graduate doesn't really know the temptations that lay upon the corner or down the street by the pier, which I'm also in a documentary called Peer Kids, The Life, and that's what started my advocacy within the LGBT realm, is because that is a place that I had to call home when I first came here from Kansas City. And by way of Philadelphia. I didn't know anything about New York City, but that's a place that I knew that there was an LGBT community that could help me navigate through New York City. But at the same sense, there was a lot within there. If it wasn't for me yearning for something better or something pure and legal, then I would have went the latter, because there was more bad than good that came from that atmosphere, because most of them are lost already. So it's just the blind leading the blind, I would say.
So we've heard a lot today about just the experience and maybe some real difficulty that young people might be facing, in
Right.
addition to some excellent suggestions on what our entire city can do
Exactly.
to mobilize around issues experiencing people of the trans experience. I personally would like to thank Kiara St. James
you.
and Crystal LaBeija for joining
you
me
for
on
having
today's
me.
show. For more information on this subject and issues related to our work at NBLACA on HIV/AIDS and other health disparities, please visit NBLACA's website at www.nblca.org or look for us on Facebook and Twitter. I would like to just give the opportunity for you to give the website for NITAG as well,
Yes.
and how people may be able to reach you.
Yeah, thank you. So yeah, folks can reach us at nitag.net. Currently, we have a website up, so folks can reach us at nitag.net. We also meet every Friday, and one of those Fridays is going to be at NBLACA Space. So we meet every Friday from 3 to 5. And also you can find us on Facebook, on NITAG. Just look for NITAG, New York Transgender Advocacy Group, on Facebook.
Excellent.
As well.
The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. Please let your family, friends, and neighbors know about this programming. I am Madhuri Jha, on behalf of C. Virginia Fields, the National Black Leadership Commission on AIDS. Thank you for joining us, and hope you'll tune in next time for NBLACA's Health Action TV here on Manhattan Neighborhood Network.